have our third speaker, who is going to be Dr. Cyriac Abby Phillips, or AKA the Liver Doc on Twitter. Dr. Phillips is a clinician scientist and senior consultant and liver disease specialist who has the largest personal Indian medical Twitter account with over 127,000 followers and growing. His core clinical work and research focus is on severe alcoholic liver disease and drug-induced liver injury in the context of Indian traditional systems of medicine called Ayush. He uses social media to promote evidence-based medicine, empathetic care, and improve scientific temper-informed healthcare decisions by using his own disruptive peer-reviewed medical publications. Over to you, Dr. Phillips.
Thank you, Dr. Murmu, for that kind introduction. Thank you to Joyjeet and the School of Information, Michigan University, for inviting me to this talk. So this is very different from the talk that I've been giving all my life. It's always been at a medical conference. So this is now a totally different ballgame for me. So I would basically want to discuss three things first. First is hepatology. That's me. That's the study of liver diseases. Second is hematology. That's basically a blood diseases specialist. And the third is herpetology, which is basically study of snakes. Even though I don't do that, but I meet a lot of them on Twitter. So my talk will be mostly on how I started science communication, especially with respect to the alternative medicine industry, and how that actually helped me grow, improve my science communication with the common person. There is always this problem when I start pitching on alternative medicine industry, which is like everybody calls me a pharma shill. You know, you are a big pharma funding guy. You've got money from Pfizer. You've got money from Cipla. You know, they're making you tweet this so that you're bringing down Indian traditional medicine culture, stuff like that. So it is very important for me to actually disclose my funding. And this is what it is. So I've received a bunch of Reynolds pens from my medical representatives, which I let my staff use. A lot of face masks and few hand sanitizers during COVID. And I've received 3 annual diaries from 2020 to 22. I'm still waiting for my 2023 diary. So that's, I mean, I may disclose that for the next conference. Now, why do we need to fight health misinformation? So, because there is a price to it. So when I started off my work as a hepatologist in 2016, I came across a large number of patients with severe hepatitis and jaundice who did not have any identifiable reasons for their jaundice and hepatitis. And I come from Kerala, which is one of the largest, which has the largest drinking population in the world. You know, it has a lot of people drinking alcohol. So number one cause we always look at in men is alcohol use. But this group of patients, they were not drinkers. They did not have any other pre-existing conditions. They never took any medicines like your conventional prescription medicine. For example, anti-tuberculosis drugs are very common cause of liver injury in the country. But these people were not on any of these drugs. So I was wondering, why did they develop hepatitis with severe jaundice? So when we look back at their clinical histories, we found out that almost all of them were actually on herbal medications. And these are all traditional Ayurvedic herbal medications. They were taking it for a host of problems like, you know, some dyspeptic symptoms, like they have like gas troubles, difficulty in sleeping, a treatment for fatty liver, constipation, and whatnot. So when we looked at the temporal relationship, so they were starting these herbal medications, and within a few days or a few weeks, they were developing severe liver injury. So we published that in 2018. You can see the upper top on the left side, about this large series of patients where we identified Ayurvedic herbals as a cause of liver injury, and that actually got a very fantastic editorial also in the same journal. So we published that in Indian Journal of Gastroenterology, which is the official journal of the Indian Society of Gastroenterology. And once this went up, it became very viral, because this was the paper that actually showed that herbal does not necessarily mean natural and safe. You know, herbal means it can land you in trouble. So after this came out, we started looking at, because this was something very new for us too. So we started looking at all the patients who were actually coming in with unknown causes of hepatitis and jaundice, and we published a series of papers on this, including patients who had pre-existing liver disease when they took Ayurvedic herbals or homeopathic formulations, what happens to them. So these papers actually show exactly what happens to them. So this is a small graph that I would like to show you from one of my papers. So if you see that first graph, it actually shows that when normal people. That is people without any underlying liver disease. They actually took Ayurvedic herbals for a host of conditions like diabetes or high blood pressure or thyroid disease or anything like that. When they developed liver injury, almost 47% of them only survived, beyond 2 years. That is more than 50% of them died because of that herbal liver injury. And this is actually a criminal loss of life because one, those herbal medications are not evidence-based. So we have no data to show that these herbal medications actually work for diabetes or thyroid disease or anything. And they were, through misinformation, led to consume that. They ended up dying. In the second graph, I'll show a group of patients who had severe alcoholic liver disease. So in India, there is this notion that if you drink alcohol with certain specific herbal medications, your liver is protected because herbs can detox your liver. This is the biggest nonsense I've ever heard in my life because the liver is your detoxer. And how can you detox your detoxer? It's crazy, but people do it. So this group of severe alcoholic liver disease patients, when they use herbs along with alcohol, this is what happens to them. You can actually see that this is a very morbid graph where you can actually see the people who actually took herbs along with alcohol when they developed liver injury. Almost 18% of them only survived at 1 year. That is more than 80% of people actually died with the herbal liver injury and the alcoholic liver injury. And the ones who were treated with standard medical care, they actually survived longer. That is more than 50% survived with standard medical care when they developed only alcoholic liver injury. But when it was with herbal liver injury, more than 50%, more than 80% of them died. So this is the price of health misinformation. All these people, the sons, the daughters, the mothers, the fathers, they should have been alive even now if they did not have that misinformation handed out to them at that time. Moreover, we have had tragic and comical reports coming out from our unit where we actually diagnosed a man with severe alcoholic hepatitis when he is confessing to us that he never drank. So I was saying, because you might have seen the House MD series where he says that everybody lies, right? So every patient actually lies. So we have to be extra careful. So what we do is we don't just talk to the patient, we call everybody, we call the son, the daughter, the nephew. We ask them, is this guy drinking? Is this guy drinking? So somebody will give us a clue that this guy is drinking because his liver biopsy is saying that he's been drinking. It's severe alcoholic hepatitis. But everybody said that this very nice guy, he works hard, he does not drink. So then where did he get that from? So we found out that he was actually taking an Ayurvedic medicine known as Dashamula Arishtam, which actually contains 20% of alcohol. And it's normalized. You can just go buy it off the internet. You can just go to local Ayurveda shops and buy it and drink. It contains alcohol, and he was taking that as a digestive for a long period of time. He developed alcoholic liver disease. Now we have had 14-year-old girl coming in with alcoholic liver disease. 14 years of age, studious girl coming in with alcoholic liver disease. Again, same. The parents were actually giving her a lot of Ayurvedic herbals for her epilepsy, because somebody told them that modern medicines are like poison. If you take it for long, you'll develop more problems and you will die of it. So they did not give her the right anti-seizure medicines. Instead of that, they started giving her Ayurvedic herbals for about 5 years. And she developed severe alcoholic liver disease because of the alcohol content in the Ayurvedic liver medicines. And she also developed severe arsenic poisoning. So this girl came to me with arsenic poisoning. And when we checked her Ayurvedic herbals, there were like sky-high levels of arsenic. She is on now lifelong follow-up for development of cancers due to arsenic. Arsenic is a bad thing to have in your body because it can cause cancers 10 years later, even after you stop it. So these are the patients that have fallen for misinformation. Similarly, even with homeopathy, we've had a lot of people coming in with alcoholic liver disease because of consuming homeopathic mother tinctures, which are rich in alcohol. Some even going up to 90%. Your 18-year-old aged Shivas Regal does not have that kind of alcohol. And this one is, and it's expensive. Homeopathic alcohol is so cheap, and you don't need to pay tax for it also. Now, a big issue of health information, misinformation from the alternative medicine industry is that they'll say that, your modern medicines contain so much of chemicals, right? So chemicals are going to harm you. But they never tell you what exactly their stuff has it. So I'm just going to give you an example. Please look at that, the number of on the side I've written Banvantanam Guliga, which is a very commonly used Ayurvedic medicine for indigestion, gastric problems, gastritis, loss of appetite. I mean, people write this, take it over the counter, right, left, and center from where I am. But do you know what it actually has? The circled area, you can actually see that it contains cow dung. Elephant dung. That is elephant dung, and it's not just elephant dung, it is meconium of elephant, which means it should be a baby elephant, and the first potty that the baby elephant does in the morning, you have to collect that. And that's part of that particular drug. Forget that. I can live with that. But below that, you can actually see certain civet. Civet is a small cat-like animal, a palm civet. This medicine actually contains semen of a male civet cat. Semen. Don't ask me how they collect that. But it sometimes contains that. I don't know if it actually contains it because this is traditional Ayurvedic medicine, which is written in the Ayurvedic textbook for gastritis. Now go to the other side, Pilocoff. That's actually a very commonly prescribed syrup for coughing in children, asthma and all that. But if you actually look at the composition, I've circled it Blatta orientalis, which is scientific name for Indian cockroach. So basically, you're feeding your kids cockroach in alcohol. It has 2% alcohol and cockroach in it. And this is the stuff that we are feeding. And this is not chemical. I'm not sure what it is. And on the other side, you can see a lot of homeopathic drugs actually contain diluted forms of common housefly, diluted forms of pork tapeworm. Homeopathy has this nonsense known as like cures like. So if they have pork tapeworm infestation, they'll actually give you pork tapeworm to cure you. Right, so they give you that in diluted forms. So you have pork tapeworm homeopathic remedies, and at the bottom you can actually see Tyrannosaurus rex. I'm not joking. I did not do a Photoshop on that. It's available at Remedia Homeo website, where you can actually buy Tyrannosaurus rex in diluted form. I have no idea how they do it, but it's there. Right. So now we come to the aspect of traditional Ayurvedic medicines, where I'm sure every Indian in this room has had Chyawanprash in your life. I've had it. It's so common that kids as Indians get fed Chyawanprash. So what is it? I mean, how is it going to help you? So there was a study done by Ayurveda practitioners themselves, which showed that Chyawanprash is absolutely useless. It's a published data. But what would the government say? Eat Chyawanprash to prevent COVID, eat Chyawanprash to prevent dengue fever. They would not talk about controlling mosquitoes. They'll say eat Chyawanprash. Mosquitoes will bite you, but Chyawanprash will save you. Right? So this is the kind of misinformation that has been handed to us. So in the alternative medicine industry, you'll have Ayush practitioners communicating willful ignorance or unintentional ignorance. I mean, poor guys won't even know that they are ignorant about it, right? And then in real science-based medicine, we actually communicate evidence or accept the lack of. So that is the difference between right information and misinformation. So when I talk about this on social media, about how the alternative medicine industry is taking everybody for a ride, I mean, these are some of the comments that I get. So I mean, I'm sure a lot of us have faced comments like this. I mean, when you actually are on Twitter. So some guys actually, I mean, I learned a lot of abuses on Twitter, by the way. So I never knew what a rice bag was. I mean, basically, it's a very bad term for a Christian, even though I'm an atheist. But they all call me a rice bag, and they talk a lot about this stuff on Twitter when I talk about it. But why I wanted to point out this particular slide is that you can actually see that most of the people abusing me are actually modern medicine practitioners. You know, they're not homeopaths or Ayurvedics. They're actually modern medicine practitioners who are on a torrential abusive, format, asking me. I mean, they're not targeting what I'm saying. They're actually targeting me. And this has been a very common finding that I've seen on Twitter when you talk about Ayurveda, because homeopathy is it's fine because it's just German quackery. But Ayurveda is much more deeper than that because it has got a religious, tradition, and a cultural component to it. So it's not easy to debunk Ayurveda from a medical science perspective, and which is why these comments come up. So when somebody abuses me when I write something, I'm actually happy because ad hominem attacks are signs of victories of reason over unreason. So you don't have to respond to that. It means that you have already won and your message has reached its target, and that's enough. So why do we have to, what do we do about misinformation? You have a choice of muting it or you have a choice of fighting it. But as a scientist and as people with scientific temperament, it is inappropriate for scientists to let misinformation go unremarked. So at every level, you have to fight this because you're not doing it for yourself, you're doing it for others. Now, what is a great tool in doing it? The most offensive response against misinformation or disinformation from pseudoscientific practices or practitioners is actually evidence-based medicine. This is a very powerful tool. So if somebody throws a misinformation at you, throw back a fact or an evidence at them. That's what keeps them quiet. No arguments, no debates. You just show them this is it, or show the lack of evidence in it. And this is exactly why what I mentioned during one of my tweets, that is to use humor tactfully, because people don't want them to consider you as an arrogant person. Yeah? Somebody says something and you say, no, it's not like that, you fool, you blockhead. That's not how you say. You use humor tactfully. And then you actually counter fiction with fact, and always respond, but don't react. So when I looked at it, I mean, when you have a lot of social media presence happening, it obviously trickles down into the the news media, the proper paper format, the print media. So a lot of work of mine has been featured in the print media, and this actually calls a lot more harassment. So the Ayush ministry actually took suo motu cases against me, saying that I am defaming the Ayurveda industry and Ayurveda science, as they call it. And I was dragged to court many times. I was even served an FIR where police officers came to my OPD one fine day and started questioning me about why did you defame Ayurveda, or why did you defame the Ayush ministry and things like that. And I had to teach them what science is, what scientific method is, and these are all part of peer-reviewed publications, and they let me go. Similar things come with, so when we talk about the Ayush ministry coming against me, that is from a direct letter from the Prime Minister's office. I sent a letter to the Prime Minister's office saying that, there are these lot of liver injuries happening with herbs. So why don't we let the Ministry of Health and Family, Ministry of Health and Family Welfare, and also the Ayush ministry sit together and tell people that, herbs are not always safe. It is important that people know about what they want to put in their bodies. Very interestingly, no investigation on their part. They asked the homeopath from the Ayush ministry, and I got a letter back saying that, these have been used 2000 years before. So it's all fine to use even now, even after showing them the data. So when you talk about homeopathy, it's a different kind of a monster that you have to deal with in India, because everything runs on experience, right? And when we spoke about homeopathy, they do something very differently from the other harassers. It's something known as doxing, where they search for and publish private or identify information about the individual, and with typically malicious intent. So this has led to a lot of homeopaths and their sympathizers coming to my lab and starting to harass my lab workers, destroying the lab place, putting that live on Facebook and calling for violence against us, because of which I had to shut down my analytical lab. I do a lot of analysis on these products, and because of that, we had to shut down the analytical lab and then move to another off-site location where nobody knew. I mean, an anonymous lab we are doing work with at the moment. So this is what happens with offline harassment. And obviously, they asked the Modern Medicine Council to interfere in my professional conduct and ask them to start off a misconduct investigation into me, because I called homeopathy quackery. That's it. That is a complaint. And they are still investigating me. I'm not supposed to come here in the US because I have a court case happening, and I had to go to the court, and my lawyer had to actually file a writ appeal against that to and stay it so that I am allowed to come here. So when I get back next week onwards, it's going to be a lot of court cases for me from the Homeopathy Society in my state. And as with every other aspect of misinformation, what we do is we publish. We publish evidence that homeopathy is a quackery. I can very, very conveniently and confidently call it quackery in public, because we have data to show that it is quackery. And the most important ally in the fight in misinformation is obviously the news media, mainstream and social media, print and visual, which is why I would like this opportunity and tell the media that they should come forward and actually talk about this, talk about our work, so that people will know. And finally, why should we fight health misinformation? So this is my last slide. This is a very nice movie called Crisis. It's on Netflix. It's about the fentanyl crisis. So there is this last bit of conversation between the two characters, where one person is saying that, they've got their approval and they'll still put the drug out. So this is same with the alternative medicine industry. They don't need approval. They just need testing, and they'll just put the drug out. In the next pandemic, you will see newer stuff coming out from the Ayush ministry. But the whole aspect is that in the second column, you can actually see him saying that, but the people will know. So that is why we do it. The people will know, and that's the best I could do, or the best we could do. So if you tell the people what the right thing is, you forget about every other aspect of it, because you're working for the people. If you tell the people what the right thing to do is, if they understand what it is, health misinformation can easily be, leveled off at the root level, because we can do that. And if we don't, then who will? And if not now, then when? Thank you.